My employer offered a checkup of my legs, and I thought, why not? Because it was free. That was the only reason I agreed, because nothing had disturbed me before then. I went for the checkup, and they told me that I needed surgery. Because that was very expensive, I forgot all about it and didn't think about it for several years. Then, however, I noticed knots of veins on my legs. I felt pain, and so I understood that the problem needed to be addressed. I was very nervous before the surgery. I couldn't wait for it to begin so that it would end as quickly as possible. I was very scared because I had never had surgery before. I didn't know what to expect.
Man nekad nav bijis dzīvē operācijas, nekad man nav spricēta kaut kāda narkozes, neko es neesmu tādu izbaudījis, un es nezināju, kas man sagaida.
Hello. Hi. How was your night? How did you sleep? Very well. I fell asleep as soon as I put my head on the pillow. I slept very well. The socks and bandages did not disturb your sleep? I felt nothing. I slept very well. I'm glad to hear that. Let's go to the next room over to change your bandages and see how things look. The only thing that I felt during the surgery was coldness and moisture which passed through my leg when the anesthesia was performed. I felt some touches and feelings when the branches were being extracted, but I did not feel the laser at all. We use the laser method on your right leg, but the latest generation of radiofrequency methods on the left leg. The post-surgical period is very similar for both methods. There were no incisions. You may feel some unfamiliar feelings between your knee and groin where the operation was conducted. Some patients feel a sense of dragging there, and they say that after laser surgery it feels as if a cord is being pulled into the leg. They feel the vein. This can be an unfamiliar feeling, but it only occurs sometimes. You may not feel it at all. We just changed your bandages. All of the wet bandages were replaced, and you'll have to wear the new ones for 5 days. You can take a shower, but don't rub the location. You can also take baths, but you will have to wear compression socks every day. Depending on the severity of the process, patients have to wear them for 1 to 4 weeks. In your case, 1 or 2 weeks will be enough. We will remove all of the bandages during your next visit. Before then, you will undergo physiotherapy treatments that will help to elevate edema. If you have hematomas, they will disappear more quickly. Any questions? What kind of physiotherapy? You will have to undergo Darson valization, which we also offer. The treatment lasts for 5 or 10 minutes. Medicine has developed to the point that thrombi will not develop, and so you don't need uncomfortable stomach injections. We have new medications which completely substitute for the treatment. 1 pill a day, and you'll be safe against thrombi. Here is the surgery's quality certificate. It shows that your surgery was performed in accordance with the highest medical standards. If you develop problems in the treated area, you will receive all of the necessary consultations and treatments for free. During the first month after the surgery, you should not do anything which involves high heat. You shouldn't take a bath or visit a sauna. You need to be physically active, though. Engage in your everyday duties. Ride a bike. If you go to a gym, you can commence workouts after 2 weeks, but only apply maximum intensity after a month is gone. You can go sunbathing only after all of the hematomas have disappeared. That will happen in 2 to 4 weeks. Can I wear high heels? What do you mean by high heels? We do not recommend heels that are 12 centimeters high.
Tā labāk augsts.
So I should choose shoes without heels.
Vispār bez, ja?
No. Shoes with no heels are also unnecessary. Wear shoes with a low heel.